Hello, and thank you for joining us today. Welcome to day one of our virtual workshop, a discussion on research and a multidisciplinary response to sexual assault. Throughout the day, we'll be utilizing poll questions to get the pulse on where our audience stands regarding the topic material. So to make sure everyone can access the polls correctly, we're going to launch our first poll now. The first poll question is, what is your professional role? Sane, safe, RN, APN, MD, forensic scientist, other crime lab staff, prosecutor, law enforcement, legislator, victim advocate, student of any discipline, or other. And be sure to give us feedback through the course evaluation link. Certificate of completions will not be available until after 6 p.m. Eastern Standard Time today. If you experience any technical issues, let us know in the chat pod or email us at forensiccoe@rti.org. It looks like we have about 80% of our participants already answering, so that's excellent. Looks like the big lead is forensic scientists with 45%, so we got a lot of scientists here. We have about 7% in the sane safe category, 2% in the RN, APN, MD, 5% in other crime lab staff, 1% prosecutor. Shout out to the one prosecutor out there. We have 7% law enforcement, 3% students, and about 17% who fall into the other category. So once again, thank you all for participating in the poll. For today's part of the workshop, we'll be watching a series of short videos punctuated by breaks for Q&A segments. During these segments, attendees and panelists will discuss the content of the videos. As a reminder, the opinions, findings, conclusions, and/or recommendations expressed in this workshop are those of the authors and do not necessarily reflect those of the Department of Justice. Thank you for your attention, and now I'm going to pass the virtual microphone over to Matthew Gamet.
Thank you. My name is Matthew Gamet, and I am the Laboratory System Director for Idaho State Police Forensic Services. And I'm here today with my co-host, Deb Weatherelt.
Good morning. I am Deb Weatherelt, the Idaho SANE SARC coordinator based here with Idaho State Police.
Thanks, Deb. We want to welcome all of you to this peer-to-peer engagement presented by the Idaho State Police Forensic Services in collaboration with the National Institute of Justice and the Forensic Technology Center of Excellence. The peer-to-peer emphasis of this event is important to all of the presenters who have been hand-selected to engage with you over the next 2 days. We wish we could be with you in person, but the situations in the world right now don't allow for that to happen. We appreciate our collaborators at the Idaho Peace Officers Standards and Training and the Forensic Technology Center of Excellence for their hard work to make this happen electronically. We have pushed the limits of the technology, and we've asked them to do things that are new to this community in an effort to engage you as attendees.
Good morning. We're very glad that you're here. Over the last year, we have worked hard on this webinar. We want to make sure that it's not only informative and helpful for you, but also enjoyable. But we're going to need your help for that part. If you will be sure, as you're watching, to jump in, answer the poll questions, go to the chat session and ask questions, give us your comments. It'll just make it better for all of us.
We tried to engage all types of learners throughout the various formats that we'll use over the next few days. We have blended live facilitated discussion with pre-recorded videos. We have more traditional PowerPoint, data presentations and things that you're familiar with, but over the next few days, everything is meant to educate, inform, discuss, and overall engage in the discussion of culture change as it relates to the topic of response to sexual assault in your community, state, or our country. We can do better. We must do better. And the only way to do that is through peer-to-peer idea sharing.
You know, we looked for presenters who are experts in the area, not only in Idaho, but across the nation, and we found them. These are experts who really have dedicated their professional careers to taking care of the victims and survivors of sexual assault, whether in the role of advocacy, law enforcement, or healthcare. These people now are not only just experts, they're our friends. We've worked with them side by side as we're working to address the culture changes needed in Idaho to address sexual assault.
We've divided the day into bite-sized segments of information. In all cases, this is headlined by Safer Working Group recommendations. As you all know, the Safer Working Group was developed to address SAFER, the Sexual Assault Forensic Evidence Reporting Act of 2013, which recommends in part the development of best practices and protocols for the collection and processing of DNA evidence in sexual assault cases. The SAFER working group developed 35 recommendations through a consensus process. We will discuss the Idaho approach to addressing these recommendations in an effort to urge a national discussion on best practices and culture change. Please engage with us to make this a true peer-to-peer learning experience. Deb, I think it's time to kick this off. What are we going to learn about in chapter 1?
Well, we're going to learn about what we didn't know about in Idaho and how we decided to approach that.
All right.
Welcome.
Let's bring on the first clip.
Welcome. Thank you for being with us today. My name is Deb Weatherelt. I am the Idaho SANE SART Coordinator for the state of Idaho. As an RN sexual assault nurse examiner, I work with the patients in our state who have been sexually assaulted to provide care for them, and I also teach other nurses to do the same. I'd like to share with you a little bit about Idaho. We are the 14th largest state in the Union, although we are the 13th least populous. And what we find with a population of 1.7 million, our ruralness definitely impacts our ability to provide care sometimes. We have 55 hospitals in the state. Only 10 of those are licensed for 100 beds or more. Actually, almost half of those, 25, are critical access only, and we do have 3 completely standalone ERs across the state. The crime report for 2020, which is a publication put out by the Idaho State Police, noted that we had a little over 2,000 reports of sexual assault in Idaho in the year of 2019. Those offenses include rape, sodomy, and sexual assault with an object. Unfortunately, our rates have climbed 5% over the previous year and 19% over the past 5 years. Arrest rates are around 13%, so we mirror the national images pretty closely. The Sexual Assault Forensic Evidence Reporting Act, or SAFER, was created to address the backlog of sexual assault kits across the nation and to recommend best practices for communities to address sexual assault. In 2018, the Idaho legislature passed a bill that created the Idaho SANE SART Coordinator. Initially, this was filled by an RN who had experience as a SANE, and she worked for our ISP for about 8 months. She did a lot of work in that period of time. She was able to identify some of our programs across the state, and she created our 40-hour SANE A, or SANE training for adults and adolescents that we use today to train nurses across Idaho. In the last year, we revamped that original 40-hour course and have had it approved by the International Association for Forensic Nurses, or IAFN, and have taken it across the state. We have had 8 classes scheduled this year. Unfortunately, like the rest of the nation, The nursing staffing shortage has impacted us, and 3 of those classes have had to be canceled. The good news is all of those have rescheduled for 2022, and we have a full slate of SANE classes scheduled already for 2022. ISP offers these classes to hospitals and SANE programs, any nurse who's interested in becoming a sexual assault nurse examiner, at absolutely no cost. Since the beginning of this role, we have been able to train 103 nurses. I know that may not sound like a lot for some of you who have 50 or more nurses at one training, but in Idaho, that's a big deal. Remember, a lot of our hospitals are critical access, and even to pull 1 or 2 nurses from staffing can be a real challenge for them from time to time. We are committed to ensuring that our hospitals, our SANE programs, our child advocacy centers, and private SANE businesses, yes, we have one of those in the state, have the personnel that they need, trained to provide victim-centered, trauma-informed care for the patients across Idaho who've been sexually assaulted. My personal goal is to improve access to standardized care across Idaho after sexual assault. I don't care if you've been assaulted in somewhere like Boise, our largest city in the state, or Preston, a tiny little village. I want the care that that victim receives to be exactly the same. Sadly, without training, there have been times in the past when a victim has been told, "Sorry, we don't do that here." And although they tried to help, maybe by buying a bus ticket for a 3-hour ride to a larger center, we know that we were re-traumatizing victims. We're changing that, and we're proud of how we're doing that. Another role for me is educating our law enforcement across the state, helping them understand what a SANE is, what a SANE is not, what we can do, and what we don't do. I like to make sure that nurses and law enforcement both understand that we are nurses first and foremost. We provide health care. And if the patient wants, we can collect evidence, and it will be done properly, and the chain of custody will be maintained so that it is valuable to our law enforcement partners. As I traveled the state, one thing that I heard over and over again was nurses saying, "Deb, I'm not really comfortable doing this. I don't think I know enough." And so in addition to all of our training, I worked with our forensic scientists and created a spreadsheet. They keep track of the things they see on the kit that could be improved, and I then send a personal letter to every collector saying, "Thank you for the work that you do to care for these patients. On this date, you collected this kit number. These would be our suggestions for improvement." And then I have a for future consideration only, where I just review our expectations for evidence collection, that we want 4 dry swabs used for cavity collection and 2 damp swab used for any non-cavity collection, things like that, just to keep things a little easier for these nurses who may not see more than 1 sexual assault in a year's time. While the focus as a SANE is on the healthcare, we recognize it takes a village to care for these patients, and we partner with advocates, law enforcement, and prosecutors. And we'd like you to hear from some of those people as well.
Today we will hear from Matthew Gammon, the director of our State Crime Lab, Rylene Nolan, the manager of our State Crime Lab headquarters in Meridian, Idaho, Senator Melissa Wintrow, Idaho District 19, Tina McBride, the executive director of the Domestic Violence and Sexual Assault Center in Idaho Falls, Lieutenant Carl Noah of the Bonneville County Sheriff's Office, Elaine Bean, the Chief Deputy Prosecuting Attorney for Bonneville County, retired Detective Angela Weeks of the Nampa Police Department, Chief Craig Kingsbury of the Twin Falls Police Department, and Emily Menges, Forensic Nurse Coordinator.
So Matthew, it's interesting that Idaho State Police is where this initiated. Can you share a little bit of how that started?
In about 2014, we were looking at several NIJ webinars and other presentations that were made about the prevalence of kits, unprocessed kits in states and regions. And we didn't really know what the status of those kits were in Idaho. So when I came back from those conferences, we spent some time talking in our management team about how we could find out. So we did an audit It wasn't a very effective audit. It was a voluntary audit of people that were willing to share information with us. And we were disappointed that we didn't get more data. And so we really didn't know still what the problem was. So we started visiting with people that might be able to give us more data, more information. And as we did so, we started to set up a group that we now call ISAKI, or the Idaho Sexual Assault Kit Initiative. And that group has, it formed initially with very few members, people that we knew were interested in the topic, but it's emerged as a very helpful group to discuss topics in our state around sexual assault.
I noticed that Senator Wintrow is a key member of this team. How did we get a senator to sit on our team?
It was really interesting. Senator Wintrow came out for a tour of the crime laboratory and just a general tour of the crime lab. And as we went through and as she and I talked, we were able to talk a little bit more about some of the problems with the DNA database, some of the problems that we were seeing with sexual assault kits. And she became aware. I told her that we had this meeting going on and that it was, I think, just maybe a week or a few days away. She asked if she could attend that meeting, which I very eagerly invited her to that meeting, because anytime we can get a legislator or someone that controls funding and has an access to that legislative process, we definitely want them involved. And so she came and was a very active participant on ISAKI. They took her in very quickly. She had great ideas. She had interest in the topics. And so she just became a natural member of the team. And it's a group that I've never experienced before in anything that I've done. They're a very, very collaborative group. They're very interested in the topic, obviously. They're spending their time working on this topic in Idaho. But it's an immensely very collaborative group that just donate their time, their skills, their knowledge, and it's an amazing group to be a part of. It started very small, but then we started to add people like, say, nurses, hospital administrators, and other people that we could see would be beneficial. But most of that was happening here in the Treasure Valley or in the Boise area, which is our state capital. And so that's natural that most of those state agencies exist here. Some of the bigger hospitals exist in our metropolitan areas. But what we quickly realized through COVID was that we had the ability now to expand into other areas of our state. At the start of this, it was mainly just we could do video webinars, but it was through extensive video systems that were costly that we could only put in a few sites in the state. But through COVID, we got access to GoToMeeting and Zoom and all of these other platforms where people could join us from their small rural towns. And that really helped us to expand into a statewide presence.
It was my first year on the job, and I was trying to get to know things that I was making decisions about. And I called Matthew Gamet and said, I need to take a visit of this crime lab because I sat on Jude and Rules. And I spent a whole afternoon here, and that's where I found out of the first meeting of the ISAKI group, which he invited me to, and that launched all of this legislation. And that team served as the place where we vetted the legislation, gathered input, made sure we were all on the same page because of the variety of stakeholders in the room. So we would roll up our sleeves, draft, send it out, tussle through it, come to some agreements, and present it to the legislature. And so we've passed 5 major pieces of legislation since 2016. I think to help transform how we're processing, tracking, and preserving sexual assault kit evidence. So what a blessing to be able to have an experience so you know directly what the system is doing. So you can bring that forward to represent somebody who's been victimized in this system, and hopefully we're helping.
All right, everyone, we're going to start our first section of the question and answer session. So we've had a few come in from the audience. So the first question we have is I guess for the panel here. The national average for arrests is about 13% of reported offenses. Do you have any stats on convictions for the primary sexual assault offense charged?
Thanks, Tyler. Appreciate you queuing up the questions for us. So I do want to bring in right now our collaborative panel here, because we have the state's foremost experts on all these questions with us. We have with us on the line, and folks will join us as we go throughout the day, but right now on the line, we have Carl Noah. He's a lieutenant with the Bonneville County Sheriff's Office. We have Angela Weeks, who is a retired detective with the Nampa Police Department. We have Tina McBride, who is the DivSAC Executive Director, who you'll hear from in a minute. And then we also have Elaine Bean on the line with us, who is a prosecutor out of Bonneville County. And I'm not sure if those individuals can hear us now, if they can contribute in. So we'll direct this first question, I think, probably to Elaine regarding any stats on the convictions. I can tell you from a state level that is not data that we're currently tracking on. It is data that we're very interested in, and data that we have research collaborators that we'll talk tomorrow a little bit more about where we're going with that and how we will collect some of that data. But I want to turn it to Elaine. Do you have any comments there?
Thank you, Matthew. I tried to just do a quick search and got on the National Sexual Violence Resource Center website to see if they had that kind of statistic. And I haven't yet found it. I can keep looking. Like you said, in Idaho, we're not tracking that number yet. That may be a good idea to do. But as we'll talk about later in the presentation, we are focusing on more things in a broader perspective than counting success only with a conviction. So I can keep digging into it and update everyone if I do find a statistic out there that would be a national statistic, but there wouldn't be one for Idaho that I'm aware of.
Thanks, Elaine. There's a question coming in from Crystal. I think this is best directed to Deb. So how did you become certified with IAFN to teach these same classes?
That's a really great question, Crystal, because it was important for me to be certified. You can't teach until you are certified. So as I joined ISP, I am the only nurse here, but I also joined the Domestic Violence and Sexual Assault Center in Idaho Falls. So first you have to have an RN license. It's unencumbered, meaning no discipline from your state board. And then you need to take the 40-hour SANE A course that teaches you how to do this, and then 16 hours of mentoring or orientation after that. And so I did those things, did the education, and then joined the DVASP site in Idaho Falls. I do take call there. So I am actually a full team member there. I take call, I go over to Idaho Falls each month and stay there and take call and assist with exams there. And then it really was about a year of studying and then sitting that certification exam. So exactly how anyone would do that. You take the course, do 300 hours of SANE-related work, and then sit the test.
Now, Deb, you are in a unique position. I think maybe the only one in the country that has a reporting structure through the forensics laboratory. So we actually have a SANE nurse that works for the forensics laboratory. Tell me a little bit about how that works, and tell me about the courses that we've set up, those kind of things.
So what we're currently teaching now is the SANE A course. And initially there was some confusion over exactly how will forensics and nursing work together. And that was on their side and my side as well. It actually works extremely well. As you know, you put me through a pretty extensive orientation with each forensic discipline. And as I am out across the state teaching the SANE A classes, almost without fail, every class, there's at least one time someone asks a question that I have to say, I'm not sure about that, but just give me a minute. I'll get on the computer during break and I'll check with the forensic scientists. So they were able to give me a really strong foundation in how forensic works. Once that kit is turned over to the lab, how is that processed? That's really important because we've been able to improve the quality of evidence coming in by the scientists looking at those kits for me, getting the information back to me, and then I take that back to the nurses.
And Crystal's asking a really important question in the discussion and answer section. So she asked how we funded this, and initially your funding is coming out of the STOP grant that we applied for and we were awarded. And so both salary and also some other things that we'll talk about, the facilitation of the class, setting up the class, providing resources to teach those initial classes, bringing in some consultants to help us with those initial classes, and then also collection items, everything from bags to cameras, everything to those sites around our community and around Idaho. But tell us about, she's asking about the improvement sheets that you mentioned. How do those work? Tell us a little bit more.
So the improvement sheets, it's kind of a two-pronged thing. I worked with the forensic scientists to develop a spreadsheet, and when they're going through the kits, they actually look at each piece of that evidence and say, This was a cavity collection. So did we use 4 dry swabs? And this is a non-cavity. Did we use 2? If the kit was expired, our kits will expire because there's a small vial of sterile water in there. So we look and say, if that kit was expired, we don't ask them to throw the kit away. We ask them to replace that vial with a vial of water from their organization and document. So was that done? So they actually go through and look at each piece of that. And then I go back to that spreadsheet and I can see the kit number. I then can backtrack to the hospital and find the individual nurse who collected that. And then I sit down and it's actually a form letter, but it starts with saying, number 1, thank you for the work that you do, because this is hard work. It's important work. We know that we impact people's lives for the rest of their life. And so I want to acknowledge that right up front and then tell them why the feedback is being given, because actually as I travel the states, nurses asked for that feedback. And so then I'll say on this date, you collected kit number, and these would be our recommendations for improvement.
Now, I want to come to Tina, and I'll just give you a second to think, but I'd like you maybe to address how those are received by the nurses and those doing collection. But while you think about that, we'll come there in just a second. But Deb, tell us a little bit more about the certification of the course and what that involves, who it's certified through, and what that gives to the nurses that are attending.
So when you put together the 40-hour SANE course, IAFN actually has a planning guide and an education table. And so you go, it's very, very detailed, and you go through and cover all of that. You have to actually apply for them to take a look at that for you, make sure that you have submitted enough information that they can be comfortable that you are covering the information they ask you to cover, and then pay a fee to have that done. So then every 2 years, it's only good for 2 years, and that's so of course that they can make sure that we're staying up to date with the information that we're presenting.
So we're certified through the Montana Association of Nursing and also through the International Association of Forensic Nursing.
Yes, we went through IAFN to approve our content, and we went through the Montana Nurses Association to provide the CEUs, or continuing education for the nurses. And the reason that we did that is just because of one of the rules that IAFN has about who can be on the planning committee, which would have cut me out. And as the only nurse at ISP, I had to be on the planning committee for the education. So that's why we went to 2 different places.
So the nurses get the training hours, they get the continuation of training hours for them. They also get the 40-hour course, so they could sit for the certification if they chose to after fulfilling the other requirements. But is that the focus of these courses?
The focus really is the healthcare. That we're nurses, and that is something that I really want reinforced over and over and over again. Although we're forensic nurses, we are first and foremost nurses. And so what we do is healthcare. We want to address the physical needs and the psychosocial needs of the patients who've gone through a tremendously difficult situation. And then we also talk about, if the patient wants forensics done, what we do, how to do that well, and how to do that properly so that when that evidence is turned over to law enforcement, it's usable. But the focus really is healthcare.
So the sheets, the letters that are being sent out by Deb, how are those being received by those that are out in the field? When you've received those letters, or your nurses have, how are those received, that feedback that you're getting from the state lab?
Actually, our nurses like that relationship. They all want to be providing quality services. And so I don't believe any of them have had a problem with that feedback at all. The nurses also have to have these cases peer reviewed. So essentially it's the same thing. It's just coming from a different source with a different set of eyes. So for us, it's not a problem. I've not had any complaints from any of my nurses.
Fantastic. And I know that the lab really appreciates it, the feedback that's going from them, and then maybe some feedback coming back from the nurses. It's helpful to the lab to know why things are happening so that we can address those issues in real time. Let's bring in Angela. Angela, if you can hear us. Crystal's asking a question about our training, and I know that you answered a little bit of this in the chat, but go ahead and tell us what we're doing for law enforcement education in the state.
Absolutely. Thank you, Matthew. Glad to be with you guys this morning. We actually just wrapped up at the end of last year. Well, I guess it was in the fall, closer to the fall, where we did 6 site locations across the state of a full day of trauma-informed sexual assault investigations. And it was a primarily law enforcement geared course, but we opened it up to nurses, to advocates, to prosecutors, to others who are also doing this work, because we all need to understand the impact that trauma has on our victims. And I know that she had also had a question regarding the funding related to that, because, you know, we're always wondering how we can support bringing in training for law enforcement. And it's looking at who your partners are in your community, you know, reaching out to the Rocky Mountain Information Network that provides resources and support for law enforcement agencies. They were a great partner of ours that helped support that training. And what we found in our experience of traveling the state is that a lot of people were saying, wow, I wish we had had this earlier, and we need to get more people trained around this topic.
Thanks, Angela. Paul, you had a great question in the chat. We're going to address that later on in the presentation. And if not, let's come back to that in a future segment here.